The ordeal cancer patients go through during their treatment is well known. But thanks to the Mobetron, a mobile cancer treatment device being introduced in the UK, things could be about to get a bit simpler.
So the Mobetron is an intraoperative radiotherapy device, so it delivers radiotherapy during surgery. It's a bit different from normal radiotherapy machines in that rather than using X-rays, it uses a beam of electrons to deliver the radiation. This is a very powerful way of delivering radiotherapy. So you can give a very large dose of radiotherapy in a very short time with very well-defined penetration into the tissues, which means that if you're a surgeon, as I used to be, operating on cancers and you find that you're in a difficult area and maybe you can't remove the cancer completely, then you can deliver a very large dose of radiotherapy, potentially as much as you might get from 30 outpatient visits, all in one go in less than 10 minutes in theatre. That means that if you have left some cancer behind, that you've treated it immediately, it hasn't had a chance to take hold whilst you're waiting for outpatient radiotherapy, and it gives you your best chance of having control of that cancer in that area. Our plan is that we will introduce it for a number of tumour sites. We're starting with tumours inside the abdomen, particularly those around tumours of the pancreas, the bowel, and the bladder or kidneys, and particularly advanced cancers or cancers that have recurred already, to try and sterilise the areas where there's greatest concern that we may not have got complete cancer clearance.
The radiation provided by the Mobetron promises to be spot on.
One of the things about giving radiotherapy normally is that the radiation given after surgery to get to an area of concern in the middle of your tummy would have to go through your skin, through your muscles, possibly through bone. It would have to get through all the organs, the soft squishy bits that are in the way. And as that radiotherapy goes through all these organs, it will cause some damage. This delivers a less deep dose of radiation, if that makes sense, but a very intense dose. And so as you're doing it during an operation where the exact area that you want to target is immediately in front of you, all of the radiation goes exactly where you want it.
Expectations for the revolutionary device are high.
We expect that we will see better local control of tumours, in that there will be fewer cancers that come back in the area where we've removed them. That's been the experience of other major centres worldwide who've used this.
The introduction and usage of the Mobetron is being made possible by the hospital's Planets charity.
The machine itself and the costs of putting it into the hospital cost around £1 million. And then for every treatment on top of that, there's an additional cost which varies between £4,000 and £8,000 on top of the normal costs of their surgery. At the moment, the charity is supporting that, and we're still actively fundraising to make sure that we can keep this machine here and keep on delivering treatments.
Starting in July, the hospital will be using the Mobetron on patients bit by bit, depending on type and position of the cancer. Nicole Ris for That's Solent.